Columbus Small Animal Hospital, loving our work. I'm Dr. Jim Kramer. This is Spike. He's a 5-year-old neutered male pug, and in fact, today is his birthday, so he's exactly 5 years old when he came to see us because, clearly, he has posterior paralysis in both his hind legs. You can see he has proprioceptive deficits in both hind paws, meaning they knuckle over. He doesn't appear to have any use of his tail, and he also had no voluntary control of his urinary bladder when he came in. We don't see a lot of intervertebral disc disease in pugs as a breed, but here's one that has it. So he's got spinal cord deficits, and we start with our protocol that includes acupuncture. These dogs get a great deal of treatment and care. They get Western pharmacopoeia, they get some herbal medication, they get certified acupuncture, here being done with an acupuncture scope, which is a machine that applies energy to the acupuncture needles, which are strategically placed. My wife, Dr. Ann, is one of the few certified veterinary acupuncturists in the state of Nebraska. Our patients tolerate these treatments quite well. You can see he felt that one, so that must be in the right spot. If you watch these videos, you'll see that many times our patients fall asleep during their acupuncture treatments. But poor Spike has a back injury, and back injuries are painful. In addition to multiple acupuncture treatments, our patients that have these conditions also receive Class 4 therapy laser treatments. Therapy lasers use light energy to impact cell metabolism, very similar to photosynthesis. And you can see Spike is getting quite comfortable. He's actually falling asleep. So we're a few days into treatment. We're trying to see if we're getting any progress. You can see he's still knuckled over completely on his right hind leg. His tail is flopping around, has very little voluntary control. He still has no voluntary control of his urinary bladder. So maybe a little bit of progress. He can stand crouchingly for just a part of a second, which is better than nothing. Our patients in this situation get a lot of physical therapy. We do want them to learn to gain confidence that they could stand and walk again. There is an emotional component to this condition. Animals like dogs that are used to being ambulatory and who rely instinctively on that for protection and a feeling of security can lose hope if their hind legs don't answer. So more acupuncture treatments, of course they're not all shown here, more physical therapy, more therapeutic laser. We haven't given up on Spike. We're going to work with him until he gets better or we realize that the situation is hopeless. So we're looking for any glimmer of improvement, and look at that, his tail is curled now up over his back, and he can control it. He's moving it voluntarily. He's actually wagging his tail. He can actually stand for just a very short while, for a second or two, before he melts into the ground, which is better than he could do before. In addition to these other modalities, hydrotherapy and swim therapy is also utilized. Of course, animals are more buoyant if they're floating, and so he can't support his weight against gravity, but with water helping he can, and look at that, he can even drink some of his hydrotherapy, and so we're accomplishing more than one thing at a time here. So you see the hand in the air on the right side, eureka, that's when he actually did stand on his own in a more normal way. Ultimately, Spike did go home, not being able to control his urinary bladder completely, and his owners actually made a cart for him because he could not walk as well as they would like. And here he came back several months later. He's able to use his urinary bladder now voluntarily, and he walks pretty darn well. So during this time, which has spanned about 3 months, he has come in for regular acupuncture treatments and other treatments while he was at home, and his owners worked with him at home. And now, while he's not 100%, he's pretty close. He's close enough to have a very good life and be able to run and play and live and be a dog. So here he is with his owner. He's wagging his tail. He's interested in life. He's able to move pretty quickly. He can jump up, standing only on his hind legs. Good boy, Spike. Good for you. Columbus Small Animal Hospital, loving our work.